what catches a bone bruise is the MRI. It cannot be detected on the X-ray. This video is specifically for those of you that like to play football. You play football as if your life depends on it. It's not like they're even paying you for it, but you just love to play football. You love going to the field. Listen to me. Hear me out. There is no problem about playing football. I'm not saying playing football is bad. I'm not saying going to the field is bad. But what happens on the field or after the field is very, very important. So, look at this. Maybe when you were playing your football, people were, football is rigorous, and people were trying to tackle each other. In the process of tackling you, somebody pushed you, and then you fell. In the fall, you landed on your knee, or you just fell. You don't even know how you fell, but you fell. When you fell, something happened to your bone. And then what happened to your bone? Maybe when you fell, you did not feel any pain or anything. You just felt like it was part of football. You ignored it. I don't want you to look away from the fall, because your bone may have sustained an injury. It can be that when you fell, the ligament in your bone, known as ACL, has been torn by the trauma of the fall, or maybe there's a bruise from the fall on your knee bone. You see, football, what it causes. So this is why it is very important for you not to ignore whatever happens to you on the football field. When you get home, maybe when you relax a bit, that's when you begin to feel the pain. You're unable to move your legs. You're unable to you're unable to bend your knees or flex it. You're unable to stretch it or bend it this way. It becomes swollen. Your walking becomes very difficult. You can use ice to put on the knee, but I would like you to go to the hospital, see the doctor, see the therapist, see those in charge of bone, and then an X-ray maybe an X-ray or ultrasound. It may be requested to see what the bone looks like or what is going on. But what catches a bone bruise is the MRI. It cannot be detected on the X-ray. The MRI is used to get this. So when this is done, they may also give you knee braces to ensure that the knee is aligned straight, that there will be no movement for like 2 weeks for the bone to be able to heal up. Then you may get a crutch. You may get a crutch. So during these 2 weeks, when the healing process occurs, there will be a lot of pain that you cannot even fathom. But you know that healing is going to take place. After these 2 weeks and you no longer feel pain, you go for another scan. This is the MRI scan or ultrasound, whatever the doctor feels is necessary. When you go back for this scan, it will now see the position of your bone, if it has healed properly. Sometimes the bone may have healed in the wrong place. So instead of aligning to the main knee bone or to the joint around that side, it may have shifted to a different area, and this is where surgery comes in. And that's when they will say that the ligament in your knee has torn. When the ligament tears, mostly the treatment for it is surgery. So they will get another ligament in your leg or any part of your body that can be used. They will get a ligament, because the ACL is the major ligament supporting the knee flexion and all. They'll get another ligament and they will cut away the damage on the torn one and join the other ligament there. So when the other ligament is joined there, they will leave it up for it to heal. It may take about anything from 6 to 12 months for you to go back to full recovery. So you see, when anything happens to you, I don't want to just say it's dislocation or something. Ensure that you know what it is, and then you are absolutely fine before moving on to other things.